The reliable symptoms are fatigue, dry skin, hair loss, neck pain, hoarseness or difficulty swallowing, mood swings, constipation, vertigo, shortness of breath, and heart palpitations. Neither the presence nor absence of any individual hypothyroid symptom was reliable. Participants who reported more than 3 symptoms had a higher risk, paraphrasing. Now, there's another component to this that we should definitely tie into this conversation, which is, like many things in biology, risk occurs across a gradient. So it's not a binary 0, 1, yes or no, but rather a graduated risk. So when we look at the level of TSH that correlates with symptoms, people who have a TSH on average of 17 tend to have very few symptoms. People that have a TSH on average of 55 tend to have a moderate degree of symptoms, and people with TSHs at roughly 100 have severe symptoms. And again, this is important coming back to my earlier point, because 40%, roughly 40%, technically it's 37.1% of people who are on thyroid hormone don't actually need it. They're not treating the cause of their symptoms. And this is why some people flounder for so long. I tried Levo, I tried adding Cytomel, I tried a desiccated hormone, and my symptoms aren't consistently improving, or my levels of TSH and T4 and T3 don't ever seem to normalize. In fact, this is something that we have seen so many instantiations of. If your levels of TSH, T4, and T3 never seem to make sense, that is oftentimes because you are being given a hormone that you don't need. So just take note of this. And I'll also refer you to what I found to be a very insightful conversation and evidenced by the fact that this interview now has over 100,000 views, a conversation with former American Thyroid Association President, Dr. Antonio Bianco, where we really went into much more detail as to why it's so important to interpret your symptoms correctly. A few things if you do have symptoms that you can do proactively. You can do a thyroid panel. And obviously this is going to help cross-reference these symptoms and the thyroid status that they correlate with. You can supplement with vitamin D, selenium, and myo-inositol, and also improve the health of your gut. We've published 2 papers to date in peer-reviewed medical journals documenting notable improvement either in the symptoms that were thought to be thyroid or the ability to improve absorption of thyroid medication when supporting the health of someone's gut. And there's also some resources for you. Obviously, there's an interview with Dr. Bianco, and we do have a course that walks you through step by step and even gives you a calculator where you can punch in your lab values to have an interpretation. You always want to check this with your doctor, but this gives you a starting point.